So over here we would discuss in short about hypercalcemia and hypocalcemia in a comparative way. So before we begin the discussion of hyper and hypocalcemia, the normal calcium level is equal to 8.5 to 10.5 milligram per deciliter. So we have on one hand hypercalcemia and hypocalcemia. So hypercalcemia, the values are more than 10.5 milligram deciliter. Hypocalcemia is less than 8.5 milligram per deciliter. Now, clinical features, it presents with abdominal pain, anuria, acute confusion, vomiting, dehydration. In case of hypocalcemia, we have circumoral numbness, digital numbness, paresthesia, carpopedal spasm, laryngeal spasm, arrhythmia. Now, there are few signs which are to be discussed in hypocalcemia. First is the Schwarzschild sign. So, what happens over here is there is contraction of ipsilateral facial muscle on percussion of facial nerve below the zygoma. So in this sign, when we percuss on the facial nerve, there would be ipsilateral contraction of the facial muscles. The next sign to be discussed is the Trochu sign. So what happens over here is carpopedal spasm secondary to occlusion of arm. So if we use a sphygmomanometer and occlude the arm over here, we will find that there would be a carpopedal spasm. Now, the next important findings to be discussed over here would be in respect to the ECG. In case of hypercalcemia, there is prolongation of PR interval and there would be short QT interval, right? And in case of hypocalcemia, there would be prolonged QT interval. Regarding the treatment part over here, it would be increasing excretion of calcium, which would be via furosemide, that is the loop diuretics, via the renal. There would be again the reducing the skeletal release of the calcium. Skeletal release of the calcium, which is achieved by bisphosphonates. Then we have to treat the underlying cause, and there has to be aggressive rehydration therapy. In case of the hypocalcemia, if it is a mild hypocalcemia, it can be treated with oral calcium and vitamin D supplements, and in case of severe hypocalcemia we give 10 ml of 10% calcium gluconate along with supplemental magnesium. So this is all about your hypocalcemia and hypercalcemia. So let's revise it. The normal calcium levels are 8.5 to 10.5. The values of hypercalcemia is more than 10.5 and hypo is less than 8.5. The clinical features in case of hypocalcemia, we have two important signs which need to be remembered. Then there is circumoral numbness and digital numbness that is present in hypocalcemia. In case of hypercalcemia, it would be presenting with dehydration, anuria, vomiting, acute confusion. In ECG, there is a short QT interval in case of hypercalcemia, whereas prolonged QT interval in case of hypocalcemia. The treatment part would be the increasing excretion of calcium via the loop diuretic, reducing the skeletal release of calcium by the use of bisphosphonate. The treatment of underlying cause and aggressive rehydration therapy is one of the integral part in the management of hypercalcemia. Whereas in case of hypocalcemia, we can use oral and calcium vitamin supplements in case of minor, and in case of severe, we use 10 ml of 10% calcium gluconate along with supplemental magnesium. You must have used this 10 ml of 10% calcium gluconate in managing cases of hypocalcemia seen post thyroid surgery. Now, when I have discussed over here that treatment of underlying causes, let's just put a light on various causes of hypercalcemia. So we can divide the causes like the endocrine cause. The endocrine cause would be primary hyperparathyroidism, be thyrotoxicosis, pheochromocytoma. It can be due to renal failure, which is secondary and tertiary hyperparathyroidism. Then it could be due to malignant disease, right? So what malignant disease it could be? Skeletal metastatic disease or multiple myeloma, lymphoma, and you could add to this list various other malignancy. Then it could be due to the nutritional causes, which would include excessive vitamin D ingestion, vitamin A intoxication. Then it would also include milk alkali syndrome. This list you might get some questions of which of the following is a cause of hypercalcemia, which of the following is not a cause of hypercalcemia. Then you have some granulomatous, which is tuberculosis, sarcoidosis. Then it could be some inherited disease like hypercalciuric hypercalcemia. It could also be due to immobilization, Packett's disease, and drug induced, which is lithium. So this is an important chart for remembering the causes of hypercalcemia. Just remember the most important, definitely the primary hyperparathyroidism, a malignant disease, skeletal metastatic disease, nutritional milk alkali syndrome, tuberculosis, sarcoidosis, hypercalciuric hypercalcemia, drug induced lithium.